Good morning, Carol Johnson.
Good morning, Bob Ponce. How are ya?
Well, it is a beautiful day in the neighborhood.
Yes.
Mhm.
Well, we need some beauty.
We
We need
do.
to see some beauty, and
Absolutely.
yeah,
Are you tired of talking about COVID? I am.
I am. I absolutely am. But I know we can't stop talking about it
No.
because people just got to know.
Right. People
They
need this
got to get the
information.
information out
Right.
for those who want it.
Absolutely. So let's start out by talking about locations in Harlem where people can get the vaccine. So we have City College. So they're doing a site there. Okay, that's good to know. The North Academic Center, or NAC building in City College. All right, so they can call this number 877-829-4692 if they're interested in getting an appointment, and they have the Moderna vaccine there. And you had a flyer. You were saying you had some more information on the times there.
Yeah, 10 to 10.
10 a.m. to 10 p.m. Okay, that's good.
Yes.
And is that Monday through Friday or?
Hold up 1 second. Something when you have so much information. Okay, so it's open every Thursday, Friday, Saturday, and Sunday from 10 a.m. to 10 p.m.
Okay, that's a good
And they
one.
are really pushing for residents of East Harlem, Harlem, and Washington Heights,
Mm-hmm.
encouraging them to use that site.
Okay, well, that's a
And so
nice big site. That's
yeah,
yeah,
and it's fairly easy to get to.
right. Mm-hmm.
Everything's difficult when you live over like on the east, the far east.
Yeah,
Um, but if you just want to take that one bus trip.
right.
However, I know, even from my building, that's like a 6-block walk just to get to
Mm-hmm.
that bus,
Mm-hmm.
get the 101. Other than that, it will be a 2-bus trip. And that's what we've been trying to avoid and get them to
Mm-hmm.
realize that you need to make it easier for people to get there.
Right. And good morning, Brother Mark McPhee. Glad he is with us. So
Brother Mark.
Yep. So getting back to these sites, we also have Abyssinian Baptist Church. And I know they had a pop-up there before, so I'm glad to see they are back available. And they have the Pfizer vaccine there. And I guess all these sites can be found on the New York City NYC.gov site. We also have Advantage Care Physicians, which is at 215 West 125th Street, and they have the Moderna vaccine. We have Ryan Health, Frederick Douglass Community Health, which is at 2381 Frederick Douglass Boulevard. They also have the Moderna vaccine. And in the Bronx, we of course have Yankee Stadium, which has been the 24-hour mass vaccination site that they have there. Have you heard any feedback of people's experience at the Yankee Stadium site?
That's been very, very hush hush. The last I heard, there still were long lines.
Mm-hmm.
And I guess that could be expected when you're not making it. I'm not sure if they're still doing how they're doing the appointments up there.
Mm-hmm.
It probably would work better if they could turn it into a walk-in,
Mm-hmm.
as opposed to the problem with the vaccines is that you're expecting a certain amount daily.
Mm-hmm.
You're expecting a certain amount. Now that amount may not show up. So you may have 2,000 doses, and then at the end of the day, you actually only had 1,500.
Mm-hmm.
Then also, what happens is sometimes you can find more than two doses in a vial, so
Mm-hmm.
they'll have extra. You know,
Mm-hmm.
and because the Moderna doesn't have to be stored at the same refrigeration as the Pfizer, but
Mm-hmm.
where are you going to get those people to take those vaccines?
Mm-hmm.
Because if you happen to have extra, you have to get rid of it. You still have to get rid of it.
Right.
So sometimes they're canceling appointments because they say, "Dawn, we had 2,000 appointments. We only got 1,500 shots." They get on the
Mm-hmm.
phone, they start calling people and canceling out. But at the
Mm-hmm.
end of the day, you actually had like an extra dose, extra two doses in one vial.
Mm-hmm.
That may happen with that whole shipment. You never know how that's going to be.
Mm-hmm.
Now you've gotten rid of all of these people. Now you need to find the people who you can give these vaccines to, which is all the more reason why they need to turn it into a walk-in, since it's 24/7.
Mm-hmm.
Let it be a walk-in site.
Mm-hmm. Well, I'm glad that the city college thing is at least open to 10. 10 to 10 is a good run, and it gives people who are working during the day the chance to go in the evening, which is good. And of course, we know that there are also availability at some of the Walgreens sites. Now, Walgreens had a little bit of a issue there, in that they got some complaints that they were not following the Pfizer guidelines in terms of the second shots. And so, what they were doing evidently is booking people 4 weeks from the first shot, but the guidance was 3 weeks.
3 weeks, right?
Yeah. So my understanding, and this is from a New York Times article, is that they have changed that and they are now doing it back to 3 weeks. But they got a little bit of the, let's just say they got their hands slapped a little bit about over that.
Yeah, and we had some stuff out there, circling, you know, about the inequities that was going on with those vaccines with Walgreens. You know,
Mm-hmm. Mm-hmm.
quite a few people was complaining about who was actually getting those vaccines.
Mm-hmm.
And I was talking to somebody about it, and he's like, "Well, they don't know what you look like on the phone." I said, "Oh, yes, they do.
Mm-hmm.
Yes, they do. Very often, especially with African American women, a lot of us speak very low and very low tones, like I do. And
Mm-hmm.
generally what we do is we pick up from our parents. If you were to hear my mother speak, I can mimic my mother to the
Mm-hmm.
point where I could talk to her sister on the phone and just bring my voice up just a little bit. Um,
Mm-hmm.
so I could mimic her where her friends and stuff didn't even know that that was me. But before
Mm-hmm.
they were ready to gossip, I would give it up and say, "Nope, it's Carol. Let me give you the mom."
Mm-hmm.
However, I've called a lot of places where people have sort of got quiet. They were trying to feel out my voice, who I was.
Mm-hmm.
And, because yes, this is Carolyn Donovan. That doesn't always work. They don't get that part of it.
Mm-hmm.
But they're trying to figure out who I am. And oftentimes they can hear your Afrocentricity in your voice.
Mm-hmm.
And so they weren't making appointments for certain people.
Mm-hmm. So I want to talk a little bit about vaccine cards, and there's been a lot of talk about vaccine passports. So we want to clear up a few misconceptions about it. So first, let's start talking about vaccine cards. Now, there's a push now to have people have their cards laminated, and and that's because basically they're paper cards, but they're starting to be used as an informal kind of a vaccine passport. I think the idea is that there might be certain businesses that before they let you in, they want to see the vaccine card. And so I think that this push to get lamination is recognition of the fact that these paper cards are not, they're not sturdy enough that you can
Mhm.
have them as an ID, because if you spill water on them or something like that, you got an issue. So I think it's interesting how they're doing that. Now let's talk about the whole idea about vaccine passports. So the Biden administration has specifically said that the White House is not going to be pushing any kind of official vaccine passport system. And this is a direct quote from the White House press secretary. The government is not now nor will be supporting a system that requires Americans to carry a credential. There will be no federal vaccinations database and no federal mandate requiring everyone to obtain a single vaccination credential. So this was at a White House briefing. Now, additionally, the World Health Organization has also made a statement on vaccine passports that they don't vaccination passports because it hasn't been shown that having vaccination, that they're not yet feel that they have the proof that inoculations presents transmission of the virus, and they have equity concerns because there are countries that haven't even been able to get enough vaccines, and to be able to have to require people to have vaccine passports when people are still getting vaccinated, it creates an equity issue. So I feel like that's actually a good thing that we're not, um, going that. And of course, we know there are, areas and states here in the U.S. would actually flip over of any type of restriction that tied to passports. I believe the governors of Texas and Florida are already putting in prohibition preventing private organizations from making a vaccination passport. Let's say necessary. Let's say if you wanted to go to a store or something like that, you'd have to present the passport or something like that. So Texas and Florida are I think either looking into or implementing some protocols to where that cannot happen. Whereas the White House is basically saying if private companies want to do it, that's their business, but it's not going to be a federal mandate.
Well, I think again it's just the mismessaging that's been going on through this entire year. Uh,
Hmm.
that again, there's going to be some restaurants and places that's going to say you got to show your card. But the
Right.
fact of the matter is, we cannot relax the protocols. You still can't be operating at more than 25%.
Hmm.
And you still have to socially distance
Right.
within that space. You
Hmm.
know, so showing that card that you got vaccinated, that should not be a mandate. That
Right.
should not be a mandate. If you're letting people in, you're taking a chance, because the bottom line is you can't forget the fact that even if you've been double vaccinated and you've waited, you've gone through that grace period afterwards when it should have whatever efficacy it should have, 96%, 94%. Um, the Johnson and Johnson is still iffy, somewhere between 68 and 86%. I'm not clear on the
Hmm.
efficacy of that one, but um, you still need to follow those protocols. Those people
Absolutely.
can still get sick. And just because I come in with a card to say, oh, yeah, I got my second shot 2 months ago, that
Mhm.
doesn't mean I don't have coronavirus.
Right.
I can still get the infection. It's just the fact we got to keep driving that home. It's to lessen the severity. It's to not have to make the call. It's to stop people from going in the hospital.
Hmm.
That's what the vaccine is for. It is not a cure.
Right.
So,
And the other thing that doesn't get discussed, because what the vaccine is there to do is to help you build up the antibodies in your body to fight the virus. So the thing is, there's already have been 30 million people who got the virus, and if you take out the 500,000 plus who unfortunately died, that still leaves 29 million people who have some level of antibody protection. So the whole thing about a vaccination passport is it doesn't address the people who may not have gotten vaccinated because they've already been sick and had the antibodies, and it doesn't say, well, what if you had an antibodies test? So that conversation hasn't really been started either. So
But that's funny that Bo, because when I asked my doctor about that, I had spoken to him about back 2019, where I know you heard a lot of people were experiencing symptoms of COVID, especially the coughing, the shortness of breath, the pain, and different things like that, fevers, and people kind of stopped talking about that in terms of like the CDC, because people were trying to figure out, could I possibly had it then? It's too many people that have experienced this. Somewhere between like July, August of 2019 and December, I just kept hearing, even now, I'm still hearing so many people talk about these horrible symptoms they had. And I know I had it, especially the coughing and the low grade fever. And so people were wondering, well, I had asked my doctor because, they just recently tested me again for the antibody. And I was saying, well, I had this bout, it lasted like 4 days, and then it got better, and then it came back again like the following month, and it was worse the next month. Could I have actually had the antibody that fought it off? And now you're taking tests. You can't find it because that was 9 months ago. And the antibody no longer exists in my system to the point where it's detectable to determine whether I ever had it or not. So that antibody thing is still so up in the air in terms of how long it lasts. How detectable it is after you've had it in that situation. None of us was going to get any testing because nobody knew coronavirus hadn't even been spoken about.
Well, the other question is also the same. Is we don't know how long the antibodies from the vaccine are going to last.
This is one of the reasons.
Yeah. So
why they don't want you to laminate those cards right now. I had the little slip that I wanted to show, and now I don't know what I did with it. But it's just like a clear plastic slip that you can put the card in. You can even, because it doesn't seal, so you can even put tape around the edge, overlap the tape so that it doesn't slip out, or no water or anything will get in, no, damage will happen. So, because that's the question. The question is, we don't know if it's going to be something like the flu shot that you may be required to take yearly. We don't know if you may have to, who knows, 6 months from now, they may have to say, well, every 6 months you have to get a booster, So you really don't know what it's going to be. Also, they talk about how some of the laminating machines ruin the cards. You don't want that to happen. So it's like in the wallet, inside the wallets, they have these clear slips where you can put your credit cards and different things in. They also sell those like in a 99-cent store. So you can get some of those and keep that card in. Like I said, just tape along that open ridge to make sure no moisture, no, damage will come to the card. But don't vaccinate it. Or heck, take a piece of saran wrap and wrap it up in saran wrap. Just make sure that you can actually see it when you look at it, because we don't know how people are going to act. And I just see a lot of shenanigans happening with these cards where people are not going to want people in their restaurants and they're going to ask you, let me see your card.
Mm-hmm.
People are not going to want you in their business. Let me see your card. You don't have the card, you can't come in.
Right.
So Joe may have to rethink that one.
Mm-hmm. Well, what Biden is saying is that they're not the federal government doesn't have an issue if private companies do it. They're just saying that they're not going to make it a federal law. And so that probably means most likely that also means with air travel, they're not going to make it. But at this point in time, there's no prohibition from the federal side from people from businesses saying they want to, you know, limit admission based on that. So it's an issue. I'm sure we are going to hear more and more about it over the next coming months, especially as we get closer and closer to May and June and summertime, when people are going to want to travel and people are going to be doing more traveling because they've been vaccinated. That right now the numbers are that 107 or 107 million people here in the country have gotten at least one shot, and 62 million have gotten both shots. So those people are going to want to be traveling. They're going to say, "Hey, I got the shot. I'm feeling good." And even though, as you said, people are still should be following protocols. Most people who get the vaccine, I think, are going to feel like they have a get out of COVID free pass and are going to act accordingly.
Well, like every situation, every holiday, there's that 2 week waiting period.
Hmm.
They wait for the numbers to roll in.
Right.
The Easter numbers haven't rolled in yet.
No, but there has been, even prior to Easter, I'm looking at this report from March 29th where they're saying new cases were up for the third straight week in a row.
Yeah.
And hospitalizations also going up. So, there has been some creeping up already, and they're also anticipating that because of Easter, there might be some uptick as well.
And Easter was wonderful weather, and I saw so many people out in the park, and I'm like, oh
Hmm.
my God, people, what is wrong with you?
Hmm.
And these were people that was, that mask removal to take pictures. That part I just don't get it. People don't realize just how delicate we are and how easy it is to get this virus.
Hmm.
People are still thinking like family. Well, this is my cousin, and I just take off the mask, and no matter what, you're still gonna have people that are gonna know that they have it, and they're still gonna come around you. They don't want to be treated like an albatross. They've
Hmm.
been on lockdown all year. They haven't seen you. They're gonna come out. They're not gonna show any symptoms. You got another rise. Just be smart about this thing. You can't invite everybody. You can't invite. You want to have a little backyard barbecue. You can't have the 35 people you used to have it. It's just that simple. It's just that simple. You make it maybe only 10 people.
Hmm.
And keep it that
Well,
small. Else we're gonna have another. We're gonna have a serious uptick.
well, I've heard you say before, common sense is not as common as it used to be. And there's a story coming out of Illinois about a rural bar where they had an opening event. And from that opening event, 46 COVID cases, a school closure, um, a nursing home COVID related hospitalization. And so 26 people who came that night and 3 staff members became cases. And then there were 17 secondary cases. And then they had to close down a school linked to it. And this is all because they had a bar opening with, no protocols, no distancing, and just nonsense. And one of the bar attendees was a certified nursing assistant at a long-term care facility, so
Mm.
she became affected and evidently brought it back to the nursing home. It's it's crazy.
That's just to repeat. It's funny. The Bible says there's nothing new under the sun, and this goes back to what somewhere around May.
We would tell. Listen, we were telling that story in May. We had another story like that in August. I mean, we
But I
keep
mean the same type of a
all
thing where
those wedding stories that we were
the
telling.
wedding story. That's what I'm talking about. That
Yeah.
wedding story where it's supposed to be 75 people and like 150 people were there, and they took it to 4 different states, and that included a nursing home, that included a prison, and so you just it's the gift that just keeps on giving.
Yeah.
And they just
And
took this thing all around, and nobody thought about how it was going to be spread. And here, next thing you know, you got 400 people got it,
hmm
especially at that time in the nursing homes,
hmm
because nobody was really, really. Um, you had nursing home staffs just walking out; they were scared. I mean, you really couldn't blame people; they didn't know what to do. So, I
hmm
mean, here we go again, and the CDC keeps saying we're just opening up too soon.
hmm
We're opening way too soon. Every time it looks like it drops a little bit, you open up a little bit more. What part of every time you open a little more, we start to see like we're seeing now, the
hmm
3 day consistent rise in infections or
hmm
hospitalizations. So here we are again. And I know Fauci just keeps saying it over and over again. And other, medical professionals, they're like, they need to do something with the travel. They need to stop people from coming in. Half the stuff that we have that we can't get rid of is coming from other countries.
hmm
We don't have the antibodies to fight that.
hmm
You know, our systems can't fight it. We're not used to those things.
hmm
But they want to keep opening the economy and kill off people. And remember, people that look like us, we're going to be the first ones to go. So, you can run and you can picnic and you can barbecue and drop it like it's hot if you want. I'm staying home.
hmm
It's just that simple. Brother Mark asked a question. He's looking for the Johnson and Johnson. A lot of people are looking for the Johnson and Johnson because it's the one shot and the
Right.
effectiveness is not as much. But then again, as they say, that all the vaccines are safe and that all of the vaccines just get a vaccine. Just get a
Yeah.
vaccine. Because again, it still will lessen the severity of it. And as Bob said, build those antibodies. But that Johnson and Johnson is going to be a lot more difficult to get. The Johnson and Johnson was promised for the homebound at-risk people, which to me made so much sense because you're not only vaccinating people that are homebound, you're also vaccinating um, their family members. Those are the people that's going in and out. They're
hmm
also vaccinating the AIDS if they haven't been vaccinated, where I don't even understand. I don't understand any aid going in anybody's house at this time because vaccines exist that you have not made it available to home care agencies. And
hmm
if that aid, I'm sorry, if that aid doesn't want to be vaccinated, there's got to be some things laid down because too many people died from COVID that got it from the AIDS.
Right. Right.
Too
Right.
many people. So I mean, you got to lay hand down. You got to lay down the law in some of these cases. So to go to a 4 member household, vaccinate all of them, and then you don't have to come back again.
hmm
But they're just using up this Johnson vaccine, and already they're seeing problems where, like, the fire department is working heavily with the at-home um, vaccinations. So they're already seeing problems where they're running out, or they're getting the Pfizer, or they're getting the Moderna, and they're saying, no, we need to be able to just go in that house and move on to the next house and not have to return.
Well, you hit on something that is something that's being debated right now. There's a story in the Washington Post. Should healthcare workers be required to get coronavirus shots? And the companies are grappling with the mandates around whether they should do this or not. So here's the situation. They're talking about, workers at, assisted living communities. And, it's just like you're saying, so many situations where these workers are the ones who are spreading it. And even that story I just told you about the nursing assistant who got it at the bar and then went and brought it into the facility. And
Right.
so, so this is a big issue that is now being debated with these companies and their workers as far as whether they should compel their workforces to be immunized. And there are a lot of intricacies in terms of public health, ethics, law, labor relations, in terms of this particular issue.
And there you have it. I mean, you still would still be putting people's lives at risk. And like Mark is asking, he got a home attendant on Monday. Should he be asking if the worker got the shot? See a lot of things that you got to learn about these agencies, these home care agencies is you're a paycheck. You're a paycheck, and that's pretty much you're like a number, a client number, and a paycheck. These agents, there was times way, 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 way back when I used to work with Partners in Care. And Partners in Care to me had one of the best programs because what they were using our LPNs to go
Mm-hmm.
into the home to take care of people that are more contained, self-contained.
Mm-hmm.
Like I am. I don't need a home health aide. I take care of my own health situation, but I
Mm-hmm.
need help with other things. And so the LPNs were coming in to assess those people and
Mm-hmm.
save the RNs to work with the people that had more serious illnesses.
Mm-hmm.
And so now what they're doing is in a lot of cases where people are supposed to get home care and the visiting nurse is supposed to come in every 6 months, they're not
Mm-hmm.
sending nurses, they're sending coordinators.
Mm-hmm.
They're sending people who used to be home care workers and they don't have any more than that. They have no credentials as a nurse.
Mm-hmm.
They're sending people into people homes who don't speak the language. You know, people, if you can't communicate with your aide, you shouldn't be in that person's house.
Mm-hmm.
And so that's all you are is a number. And you need to get to your agency and let them know that there's certain things. I don't want this person in my house. They can't understand me. They're here to help me. They can't help me if we can't communicate.
Mm-hmm.
They're sending in people who they just don't know anything. I don't know where they get some of these people. But the
Mm-hmm.
bottom line is the agency is getting a paycheck.
Mm-hmm.
So you need to come up against the agency. The other thing is in areas like ours, they have what they call casas, which mean house. So you may have three casas in this agents in this area. None of the really good home care agencies that are vetted where when you call you're going to get somebody on the phone, they're going to respond to your problem. They're not in our areas. They're not in our areas.
Mm-hmm.
you know this is where you got to keep calling. Nobody ever shows up. Nobody knows anything. They keep sending the same people back to your house. They don't respond to your needs. And then for that you need to go to the Department of Health, because now it's getting really, really, it's been serious for the last year. So in order to protect yourself, you have to make sure that that agency understands you're the client. If you want proof that that person has been vaccinated, then you are entitled to have that before they set foot in your house.
Mm-hmm. Yep. Now, there is another story we should talk about, which is um, there's more evidence about it's saying 1/3 of COVID-19 survivors received a neurologic or psychiatric diagnosis within 6 months of being infected. According, they did an analysis of like 250,000 electronic health records. And so they're finding that there is a high incidence of people having either some sort of neurological problem or a psychiatric problem.
Yeah, I've heard a lot about that. I know a lot of people who, thankfully, I know a whole lot more people who survived it than
Mm-hmm.
those that died.
Mm-hmm.
Um, and a lot of people are talking about that. I was talking to a lady the other day, and she said her gait is like just off,
Mm-hmm.
and she knows it's COVID related. She said it's not. It's one thing to, in the aging process, your joints start to crack, stuff like that. She said, but she's losing her balance.
Mm-hmm.
And before there was nothing pre-COVID, anything of that sort happening with her. But to walk, she's giving me an example, and she lives in an apartment like mine. So to go from your front door to your living room is maybe about 50 feet.
Mm-hmm.
So to lose your balance 3 times in 50 feet, and you have never lost your balance like that before, where you're actually bouncing off the wall, there's something going on there.
Mm-hmm.
There's something going on. So I see a lot of people have gone out and they bought walkers. They're walking on canes. That gets to be difficult because the fact that you're now losing certain abilities, it's not easy to have them treated because they've still got this thing where, okay, if you need a cane, you need to go to a physical therapist first. They need to find you a physical therapist. You need to go to a physical therapist. The ironic part about that is I had a walker, a scooter, a wheelchair, and I said, I need a 4-prong cane. We have to send you back to physical therapy. I've got all of these apparatuses in my house, and you have to send me back to physical therapy when you see me walking on a cane. So you already know that I know how to operate on that cane. But before, because most people do walk on them wrong. Let's be honest
Mm-hmm.
about that. But now that you actually see that I know how to ambulate with the cane, I
Mm-hmm.
have to go back to a physical therapist to get somebody to get my insurance to pay for it.
Mm-hmm.
Doctor to order it. Other than that, I have to go out and spend $30, $40, $150 on a walker.
Mm-hmm.
So there's so many different things that have just been overlooked, and as they come, like what you're saying, as things crop up, you need to have somebody ready to look at those things.
Mm-hmm.
They've opened this thing up with the home care thing too long to still not look at everything and to still not be examining everything under there. That's what recovery is all about.
Mm-hmm.
You automatically know you got a team that's doing emergency. You've got a team energy. You got a team that's doing food. You've got a team that's doing healthcare. You got a team that's doing transportation. You've got a team that's working on everything. And as the problems arise, first of all, that team should already know this is not the first time we've had epidemics. And we also look at models from other countries. Our model for the COVIDE may have been Lower East Side, but we were also looking at the floods and the earthquakes in California and Colorado. We looked at their models of
Mm-hmm.
how they handle things. So you need to have teams that's handling every facet of what an emergency will bring. And that's what's lacking here.
Mm-hmm.
That's what's lacking. Because the neurological thing and people having problems has been up more than 6 months. More than way beyond 6 months. And nobody's looking at those issues. People are literally falling in the street. Nobody's looking at that stuff.
Mm-hmm.
So I don't know, people. We're really sort of in a conundrum, we're gonna have to continue to fight for our lives because we still continue to have to see these inequities. Know where you are, know your district, We still got to look at redlining. We still have to look at the fact that we are placed in certain places in our communities for a particular reason. And if you do even a little bit of the history of your community, you'll see that you have the worst of everything or it's non existent.
Mm-hmm.
So there's no question as to why black and brown people are still not being vaccinated, why black and brown people are still not being tested. The subliminal messaging about people being afraid and all of that, they keep feeding us, and some people are actually believing that even though they didn't believe it before. you know um it's Tuskegee. People didn't even know what Tuskegee was. There's a whole lot of things. Make a sound decision. Make a sound decision. And remember, when you're protecting, when you get that vaccine, you're not protecting you, you're protecting me, you're protecting your family members. If you
Mm-hmm.
opt not to get it, that is absolutely your choice.
Mm-hmm.
you know Wearing masks, social distancing as you're being told to do, that's not your choice. That's not your choice.
Mm-hmm.
That's a mandate. So it's time for us to go back, roll back to the 40s, roll back to the 50s, places where we should have never left, because a lot of us have continued to fight the way our parents and grandparents fought.
Mm-hmm.
But it's time for the community to get together. And you don't need a large group. You could take 4 or 5 of your neighbors and storm those offices, your elected officials. Get everybody to call them and let them know things that you demand. We put you in office. These are the things that you need to make a demand of. And these elected officials here, like in East Harlem, they need to form a joint front. Everybody's kind of here, there, because that's just the way it is. But
Mm-hmm.
they need to pull together as a contingency so that all of them are fighting for their community. Because this is too long. We've been going through this and we're still going to go through it. And it's time that somebody speak up for us. But more importantly, it's time for us to speak up for ourselves.
And I think that's a note where we can probably close this out for this morning. Um, we're still in the midst of it. We continue to say the same things. Please practice social distancing. Please understand that the numbers are not going down right now. They're creeping back up. And so don't let the nice warm weather fool you. We're still in the midst of this pandemic. Um, Thankfully, less people are dying. I think that they have better understanding of how to handle people in the serious when they get to the serious condition. But as we have been talking about, you don't want to get to that point because people who are surviving with this are having myriad long-term effects. And unfortunately, there's even another story about how 40,000 kids have lost a parent to COVID. It's this is not a joke. So we'll continue to get the best information to you guys available, both locally and nationally. We're keeping an eye on all the stories. We're keeping an eye on the stories about what's going on the federal level. There is one story I didn't mention is the fact that they had this. So evidently they had the federal government had a so-called insurance policy in terms of vaccine shortages, where they had this company called Emergent Biosolutions based out of Maryland, and they had a factory that's supposed to be ready, on a moment's notice that they can start manufacturing vaccines. And so they put this vaccine into this factory into operation to make Johnson and Johnson and AstraZeneca doses, but the factory hasn't been certified and had all kinds of cross contamination problems. So they literally had to
Mm.
they're having to destroy up to 15 million doses of the Johnson and Johnson vaccine because it was contaminated. and this is just it's really just mind-boggling that this is supposed to be the backup plan, and the backup it's like having a spare tire in your car in case you get
Mhm.
flat, and then
With a hole.
when you when you go to look for the spare tire and it's got a hole in it, and
Right.
it's like
Right. Exactly. Oh, there's
mhm,
something I just sent you too. That people may need, because I know a lot of people were really stretched to the gills.
mhm,
People get insurance. Get life insurance.
mhm,
Please, we can't stress that enough. And there is help. I believe it's starting April 9th.
mhm.
There is help for people who have experienced a loss. I think this is more like a reimbursement if you
Oh, this is
spent the
yeah,
money and you
right.
buried somebody and you had to spend out of pocket. That FEMA is they've got a program where they will be reimbursing people. They're not going to give you the money to bury the people. You missed out on that one. There was a time during this when it was actually giving you money, certain amount to bury someone, but now it's about a reimbursement,
Mhm,
you know. And also, as grim as it may be, you know, there are people that are still looking for their loved ones. Check with the medical examiner.
mhm,
In Brooklyn, there's makeshift refrigeration units where they have like close to 800 bodies that have not been claimed. But they
mhm,
do not want to just put in Potter's Field.
mhm,
So you might want to check with the New York medical examiner, give them as much information as you can on a family member, because there was such a mismatch. People were going to the wrong cemeteries, they were going to the wrong funeral homes, people were leaving the hospitals, they were sending people from one place to another, and and people were just so overwhelmed they didn't know what to do. But now that things have kind of relaxed a little bit, and you're still wondering about Uncle George, cousin
mhm,
Mamie, you might want to make that grim call to the or assist someone by calling
mhm,
the medical examiner and
mhm,
giving them, as much information as you can, and see if they actually still, you know, have your or that person's loved one.
mhm.
They don't want to bury these people without, some people just didn't have the money to bury them, but they don't
Right,
want to just bury people that they haven't heard from their families. So,
right.
we're talking about a year. Some of these people might have died like a whole year ago,
Mhm.
and they're still holding them. So please, if make that call.
Yeah, absolutely, absolutely. All right, so this has been the HEN COVID update. Share this information with your friends, loved ones, and check back with us. We're always here on Wednesday mornings at 9:30 live on Facebook and YouTube. So stay safe.
We love you. Nothing you can do about it.
That's right.